So what are some of your views on legalizing marijuana?
Well, I think the issue with legalizing marijuana right now is that it's so inconsistent among the states. So you have some states that have pretty lax laws about it, other states that don't have any legalized marijuana, and some that are considering it. Minnesota is, one of the states that's probably working really hard to do it in a systematic way and be mindful, and not like California or Colorado, where it's a pretty lax system right now. So Minnesota, they've slowly made their laws, and they're adding conditions that legalize medical marijuana. So we're talking medical marijuana in Minnesota. So other states have more than just medical marijuana. So there's a difference. So Minnesota, we're talking medical, and the criteria for who gets it, what are the conditions, and how we keep it safe and legal.
What are some benefits you think there are for legalization?
Well, certainly for some conditions, definitely if you see the positive effects that research has shown, anxiety, depression, has other consequences. So it's hard to know. Right now, there's just not enough knowledge, but there's enough professionals, psychiatrists that are against some of that, and they have valid reasons. And then there's practitioners on the other side that seen it work. So you're getting a lot of mixed messages.
Do you think, in general, medical marijuana is a positive or a negative?
I think it can be positive for the conditions that it's really, research has shown that it really does affect. If I have a 5-year-old child having intractable seizures, and taking that medical marijuana is decreasing her seizures so that she can learn, and well, for sure, but I question, just because of my background and how much medical marijuana is useful for certain conditions, for more psychiatric conditions, because I've seen negative effects of marijuana. But legalized marijuana is different than the marijuana that you get on the streets, so that would be really, taken in, it's different, it's not the same, and it's medicinal purposes. But, it's not approved by FDA, it's not a prescription. People think it's, you can go into the farm, that would be really, taken in, it's different, it's not the same, and it's medicinal purposes. But, it's not approved by FDA, it's not a prescription. People think it's, you can go into the pharmacy and get it. So a physician right now has to certify that you have the condition that Minnesota says you can take medical marijuana for, but they're not giving you a prescription for it. You can't get it at Walgreens. So that's a difference. So I couldn't, if somebody here needed medical marijuana, I couldn't give it to them because they don't have a prescription for it. You see what I mean, the difference? But could it be useful for certain conditions? Absolutely. But not all conditions. I don't personally believe.
How would you compare marijuana to other legalized substances, including alcohol and tobacco?
So alcohol and tobacco are pretty harmful substances, right? And they're legal. They're legal if you're over a certain age. And so, again, medical marijuana has different properties than the marijuana you're going to buy in the street, And again, if we legalize it, if you're under the legal age, you couldn't be taking it anyway, right? Colorado and California that have legalized recreational marijuana, they still have limits on who can buy it and how much, right? Pain from end-stage cancer or other pain that traditional medication doesn't impact. So there are some things I think that the use of medical marijuana has been shown to be effective. There are other things that it's questionable. We just recently legalized it for post-traumatic stress disorder, and there's lots of research with psychiatrists, people that treat PTSD, that don't believe that there's enough research to show that that's a positive medication for PTSD. and for anxiety, depression. You know, so the research is mixed. So if you go by the person taking it and they say their life is better and they can manage it, yeah. But then if you look at the other research that says taking marijuana for anxiety, depression, you know, has other consequences, you know, so it's hard to know. Right now, there's just not enough knowledge, but there's enough professionals, psychiatrists that are against some of that, you know, and they have valid reasons. And then there's practitioners on the other side that seem it work. So you're getting a lot of mixed messages.
Do you think, in general, medical marijuana is a positive or a negative?
I think it can be positive for the conditions that it's really, research has shown that it really does affect. If I have they're making a lot of good money, the government, because they're taxing it, right? So they're putting a lot of money back into schools and roads and things, so that's a good thing, right? But they're also seeing that, there's been some negative effects too. What do you think would be a negative effect when you legalize medical marijuana?
Probably other people trying to get the medical marijuana.
Well, yeah, there's people trying to get it, but it's different. But it also then makes people think marijuana is okay to use, you know, outside of medically, because if it's a pill, just like the biggest increase in drug use among adolescents is prescription meds. Well, you know, if it's prescribed, it must be safe, so people aren't misusing, you know, narcotics and anti-anxiety meds and things that are prescribed. So if you see that marijuana is legal, then it must be safe and it must be okay to use. You know what I mean? So there's that making it not normalizing the use of marijuana by making it legal. Well, we're only making it legal medically here, but if we make it legal recreationally, again, you know, like alcohol, we still don't want 14, 15, 16-year-olds to use it, right? You know, and it is illegal to use it anyway, but.
And what's the main difference you see between the high CBD, low THC pills, medical bud, and then the legalized bud, and then just buds that you